I'm Alison Donley for Cecil TV. With some new COVID-19 related developments locally and statewide, we're here today with Cecil County Health Officer Lauren Levy. Lauren, thanks so much for joining us.
Thank you.
Cecil County, along with the state, had been seeing a decline in COVID-19 infections that began after April 20th. After bottoming out around the 1st of July, the case and positivity rates are headed back up. As of today, Cecil County has about 11 cases per 100,000 and 6.5% positivity rate. Both of these figures are higher than the statewide rates. At the same time, Cecil's vaccination rate lags behind most of the state. 42% of Cecil Countyans are fully vaccinated. This is compared to 55% each Harford and Kent counties. Lauren, are there still measures that can be taken to get unvaccinated people to get the shot?
We think so. We have been working really hard over the past several weeks on communications and messaging to reach the folks that are still hesitant and those who have been opposed to vaccination up to this point, to really talk about some of the concerns that we've heard. We did a non-scientific survey on our social media platforms, asking individuals who had not yet been vaccinated the reasons why they had not been vaccinated. So we have been using the data that we've collected through that survey to inform our approach going forward. And some of the responses that we received are people who were still taking a wait and see approach. And I do think with the news about our rates going up, we are starting to see an uptick in demand for first doses, which we're really pleased about. At the same time, we're really trying to increase and improve access and make things more convenient for people. So we've really been working closely with our community partners in order to offer vaccination opportunities at the National Night Out this past week in Elkton, for instance, and other community events. We have some other community events coming up, and I encourage people to go to the Cecil County Health Department website to see those listed. Walk-ups are welcome, but people can also register in advance to save some time. We're trying to offer those in different regions throughout the county because we know that transportation can be a barrier. And we're also trying to offer them at different times of the day. We know that people have different work schedules. We continue to offer vaccination here weekly at the health department. Christiana Care Union Hospital is also offering vaccination. It's really widely available through a number of different venues. The local pharmacies have them available. Supermarkets with pharmacies have them. So I really encourage people to take advantage of that. So like I said, we're trying to increase the convenience factor, and we're also trying to improve our messaging and education. So we've also been working with those same community partners to try to identify opportunities for education among populations. For instance, the recovery community. We know that vaccination rates have been fairly low among that community. So we're working closely with community-based organizations like Honor Own of Cecil County and Voices of Hope of Cecil and Harford County to schedule some upcoming events where we can do some outreach and some offer vaccination at various events that they have scheduled. Again, to both provide education, allow people the opportunity to ask questions, and have the vaccine available for them if they decide that they want to get it.
Yeah, it seems that, I mean, over and over again, you read about how to in each place, county, state has different networks that are better. So engaging those networks to get to harder to reach parts of the population seems to be the way to go.
But we certainly hope so. We really are trying to get these rates up. There's no question that the Delta variant is highly transmissible. We're really, really concerned about the increase, as you've mentioned. 1 month ago, our positivity percentage was 3.22%, and now it's more than double that. So, we're definitely concerned, and, just trying to make the resources available, and also, encouraging people to use the mitigation strategies that we already know are effective to help reduce transmission. I know that nobody loves to wear a face covering, but it is an effective way to reduce transmission. And so that was why we released our public health advisory a few weeks ago, encouraging people to begin wearing face coverings again indoors, regardless of vaccination status.
So the health department announced this week that it's investigating a COVID outbreak linked to the Cecil County Fair, which ran through from July 23rd through the 31st. Have there been any findings that you can share?
And it is an investigation into a potential outbreak. We were alerted to several cases that were associated with the fair, and the circumstances of those cases were such that we had to issue a press release because contact tracing wasn't going to be possible. That's not normally our preferred method of conducting contact tracing, but because, like I said, the circumstances of the cases that were identified, we wanted to make sure that the public were aware. We want to provide the community with the information so that if they were to become symptomatic, they know that they can seek testing and act accordingly. And also, for those individuals who weren't at the fair, but the fact that there were cases at that event, maybe it will encourage other folks to get vaccinated. But the reason that we released that press release to alert people was just so that people were aware that there may have been exposure. For most people, it's probably unlikely that they had interaction, but there's no way for us to know, which is why we had to handle it the way that we did. And that was based on the recommendation of the state epidemiologist.
You had been in your health officer role for less than a year before COVID-19 showed up in Maryland. How does it feel to be leading the county's response to the worst pandemic in over a century?
How does it feel? So I have tried to really focus on the positives and the silver linings. This has been a very challenging time for all of us in a lot of different ways. And the things that I like to focus on are how fortunate I am to work with such an amazing team here at the health department. And really, just the way, not just the health department, but our community partners and members of the general public really pulled together to help us, particularly around the vaccination effort. I mean, that was really a massive effort and really took a lot of different players from a lot of different sectors. We had, we have relied very heavily on our partnerships with Cecil County Public Schools and the Department of Emergency Services and the Department of Community Services and the Sheriff's Office, all of those different agencies working together to be able to stand up those mass vaccination sites. It was critical for us to be able to get those in place and to be able to distribute that efficiently and effectively. At the same time, we really had an outpouring of support from the general public, and we're able to bring on a number of volunteers from the general public who helped us with those clinics. And so I'm really grateful for the community in Cecil County, the way that everybody really pulled together in a very challenging situation to help us to be able to get the vaccination drive going as well as it did.
Do you have any advice for people who may be talking to friends and family who are hesitant about the vaccine, about how to encourage in an effective way those people to get the vaccine?
I think that the best thing that you can do is to talk to your healthcare provider about vaccination and talk about the safety and efficacy and what we have seen so far. I mean, there is no question that this vaccine is effective in helping to prevent serious illness and hospitalization and death. It's very clearly demonstrated in the data that we're seeing. And I'm so grateful that, this vaccine was developed very quickly. And I think a lot of the hesitation that we're seeing is around how quickly it was developed. And one of the things that I think it's important for people to realize is that a lot of the science that was used to develop the vaccine has really been in development for many, many years. So it's not, it didn't just happen overnight. It relied on science that has been ongoing, research that has been ongoing for many years. And we were very fortunate that they were able to marshal that research to be able to develop these vaccines to address COVID-19 effectively.
Cecil County Health Officer Lauren Levy.
Thank you. I really appreciate the opportunity to talk with you.